All right, good evening, everybody. I think we're ready to begin. It's about 7:02. My name's Ruth Arisman. I'm with Susan Glassman. I'm a co-president of Women's Voices Raised for Social Justice. And we really want to thank you for being with us this evening. With our inability to gather in person, and the important issues that have emerged around us over these past months. Women's Voices has been very concerned about how we can best stay in touch with our members and how we can do the education and the advocacy that is our mission. So we did decide to begin our education programs early and in the summer, and this is our first one this evening. We will have another program next month. We'll have Jamala Rogers and Prosecutor Wesley Bell speaking about reimagining public safety. Our book club is beginning again, and we have a lunch and learn planned on July 21st with Percy Green, who is a seasoned advocate and always an interesting speaker. So I want to encourage you to take a look at our website for details about those and to join us whenever you're able. I don't think it's ever been more important for us to raise our voices, to write letters, to send emails, to make phone calls, to get out the vote, to vote ourselves, to march, to really stand up for the things that we believe and value. It is our right and our responsibility to create a more just and equitable world, and it's a wonderful thing to be part of this effort. So I'm going to turn over the program to Nancy Nix-Rice, who is going to introduce our speaker. Nancy is a board member of Women's Voices, and she is the chair of the program committee. Nancy?
Hi, everyone. We're so glad that you're here with us today. Ruth was just reminding me that at the very first ever meeting of Women's Voices Raised for Social Justice, she herself was the speaker, and her topic that night was, wait for it, Medicaid expansion. So this has been a long, long journey, and it really does feel like this could finally be the moment. So we're really excited to have a speaker this evening who understands that really he's preaching to the choir, but the good news is that it's our job to go out and recruit more choir members with the knowledge that we're going to gain this evening. Our speaker, Mike Whittier, is the coalition's director for Yes On 2 Healthcare for Missouri. He has a lengthy background in healthcare policy, and I'll let him share those details with you, but we are so glad to welcome Mike to get us up to speed on this critically important issue.
Good evening, everyone. It's such an honor to be with you. Yes, Ruth put the pressure on me a little bit to make sure that I communicate Medicaid expansion correctly and follow her on her heels so that that message is succinct with what was shared before. But it is truly an honor to be with you all and sharing this information. So just give me just a second here. I'm going to share my screen for everyone to see. And I just want to make sure, does everyone see my screen? Okay, awesome, awesome. So as I mentioned, it's an honor and privilege. I'm Mikel Whittier. I have the privilege of serving as the coalition's director for Yes On 2 Healthcare for Missouri. And as Nancy mentioned, I have an extensive background in access to care work. I've been in this work for almost over a decade now. And so it's really a privilege to continue this and to continue the work of so many phenomenal leaders like Ruth, but then also being able to raise awareness on, and I say in St. Louis is a city and a region run by women, and we should continue to elevate that and reduce the inequities that exist across gender lines. So this is truly a humbling experience and honor to be a part of a conversation with so many fantastic leaders. So I really do mean that from the bottom of my heart as I share with Ruth, Nancy, and Laura. And so we'll just go ahead and get started. As noted, Yes on 2 is on the August 4th ballot. And so what I'm going to do is really just talk about the key facts around the issue, the evidence that has been reported on, that has been generated by reports that I imagine many of you have already read for quite some time now. But I just want to reinforce the campaign strategy, but then also let you know about how you can get involved, some things that you can do as we ramp up communication, advertisement, and voter engagement going into August 4th. And so a little bit of background. Again, Ruth, and that first presentation couldn't have been any better or timely because we do know since 2012 there have been leaders throughout the state that has been working very diligently to get Medicaid expanded. And that has been a challenging feat for our leaders throughout the state. The state legislature didn't act on it. But what we do know is once the people and the people throughout the state had the power to do so, they exercised their voice. And so this was a bipartisan and in my strong opinion, a nonpartisan effort by Missourians, healthcare providers, organizations, grassroots organizations and associations, businesses, to give the people back the power. And because of that, we not only achieved the necessary number of signatures, we overachieved and got over 300,000 signatures turned in to get this on the ballot. So the people have spoken. And so now we want to reinforce the evidence, some of the misinformation, some of the myths around Medicaid expansion, so that voters can not only go informed to the polls, but they can also feel protected and safe during a pandemic. And so what does the current coverage look like for Medicaid eligibility? And so I just want to focus on one of these figures in particular, and that's the 18 to 64-year-old that right now has to make less than $3,600 annually to qualify for Medicaid. And I'll repeat that, $3,600 annually to qualify for healthcare coverage. And so we want to begin the conversation there. There's tough eligibility requirements in the state of Missouri. This is something that's not communicated often. And the largest percent of individuals on Medicaid right now in the state of Missouri are children and disabled populations. And so we want to reinforce some of the myths that this is for people who are poor or welfare or whatever the case may be, because in actuality, you have to have nothing in order to have it. And majority of those qualify because of a disabling condition or they're a child. And so really speaking to families, for a family of 3 in the state of Missouri right now, you have to make less than $301 a month to qualify as a family of 3. So a two-parent household with 1 child, or a single mother, single father with 2 children, they have to make less than $301 a month. And so we know that enables folks to not work. And so we want to begin to extend healthcare access for our hardworking Missourians, and other demographics that are vulnerable as well. So we see seniors have to have income of less than 10,000 annually, and same for the blind, visually impaired, and our disabled population. And so this is where we begin to say who benefits when the eligibility criteria increases. Who are those populations that benefit? And so with Medicaid being expanded, we'll see the federal poverty line increase to 138%, where now those making approximately 28,000 a year can qualify for Medicaid, who don't qualify for family or disabled persons, or those over the age of 65. And that really equates to $13.78 an hour. And so these are people who are working full-time jobs, working multiple part-time jobs. In the case of a pandemic and the economic crisis we're in, those essential workers that are really working on the front lines, risking their lives to be able to provide essential services to community members who desperately need it in this time of crisis. And so as we look at demographics by race and ethnicity across the state, what we see is our white communities will extend about 71% now are eligible for this across the state. Of the total patient population, 18% will be folks from our Black communities, 6% from our Latinx communities, and that remaining 4% from other communities across the state. And so when we talk about that whole pie, we're talking approximately 250,000 people in the state of Missouri now eligible for Medicaid under the new expanded criteria. And so, as I mentioned, this is not, as noted, a welfare program. This is to enable our hardworking Missourians who have worked so hard, healthcare coverage, excuse me. And so really extending that to those who are working so hard during this time. You have at least one full-time job. Those holding that, it will extend it to 71% of those within the patient population, or the projected population in that 300,000. So again, 71% of those individuals have one full-time job. Multiple part-time jobs, or at least one part-time job, make up about 14%. And then lastly, non-workers about 15%. So again, dispelling this myth that those who will be covered under this are not working. That's completely false and not true. So who are those workers? Those workers are our food preparation and service related occupations, totaling in about 260,000. As we know that everyone won't apply for Medicaid. And so we want to be clear and transparent about those numbers as well. In addition to that, personal care and service occupations, our grounds, environmental staff, our maintenance crews who are keeping our hospitals, healthcare organizations, our office buildings clean and sanitized during this time. But then lastly, our healthcare support occupations. And so those nursing assistants, nursing aides, those occupational therapy assistants, physical therapy assistants, etc. You're seeing that, again, that workforce in particular that has been so essential, I can't express it enough, is who benefits from Medicaid expansion, having access. We know that many of whom do not have a livable wage, so you have to choose between survival and employer-based insurance. And that's something that we shouldn't force so many in our communities to choose between. especially when there's an ability to expand access and bring our tax dollars home to cover those expenses. And so for the remaining half of the presentation, I'm going to dive into what is the campaign doing to get the messaging out? What are those key points? What has been the objectives? But then what are some of those key dates? And so really, I want to just first point out that this was on the November ballot initially, but got moved up to the August ballot because of the implementation process, according to the governor. And so really, we wanted to make sure that we get this information out to all of the registered voters, but then also those who are not registered. Yesterday was the last day to register to vote. The campaign had its social media and digital push to get people registered to vote. But as we see, we're targeting about 3.9 million voters across the state of Missouri. And based on projections going into the August election, we're going to have a larger than normal turnout, which we're excited about because, again, Missourians asked for this initiative in particular to be on the ballot. So we're excited to see that outcome of the people's voices. And so what is that strategic plan? And so I mentioned the strategic objectives. I'm going to share the messaging framework, and Women's Voices Raised for Social Justice actually has access to all this information, but I'll also be sure to share this information with you all immediately after this presentation. And it'll have all the links and everything that we go over here. And so you'll have those campaign resources. And as I mentioned, I'll outline the remaining key dates. And so what are those objectives for the campaign? As we know, this is a nonpartisan issue, such a diverse coalition ranging from multiple faith groups, multiple organizations, left-leaning, right-leaning. No matter who you are and where you're from, you are probably represented in multiple organizations within this coalition, which is really cool to see. And the coalition is comprised of over 300 plus organizations now who have endorsed Medicaid expansion. And so what we really wanted to do is solidify support with those likely voters, explain how you can turn out and turn out safely. What are the steps for absentee process, and what can you do to ensure for those who are high risk can practice their constitutional right to vote in a safe manner. In addition to that, we wanted to grow support for those who are on the fence. And so, as I mentioned multiple times, we want to be sure to dispel any of those myths, any of the things that's miscommunicated, any potential adversary messaging around Medicaid expansion, because we know it will happen. We know it's already happening. And so we want to be sure that we can get this information out to our coalition members, their constituency, their stakeholders, to continue to share and advocate for this key issue. But then lastly, we have to get people out to vote. We have to make sure we mobilize people and then act. And so we have an effective get out to vote, which we call GOTV strategy, to ensure we get out our key groups, but then those likely voters and sometimes those inactive voters as well. So very targeted advertising to make sure we get those areas throughout the state who has a large inactive voter population re-engage with the voting process. And so what are those key messages? I won't read this verbatim. Again, you will have this slide deck, but I really just want to go over those 3 key messaging points. And that's really all centered around what is the impact on the state of Missouri. And so that first message, first and utmost important message, yes on 2, yes on 2, and yes on 2. I can't say it enough. And really, we say this not because we are the ones behind the campaign, but more so because of the impact it has in our state. And so first, it helps our economy. I think that is undervalued sometimes in this conversation because uh, the question comes up is, what is the cost? What is the cost? And really it's cost neutral. But not only that, it brings jobs back. It brings jobs to our rural areas. It brings jobs to our urban centers. And those are quality jobs. You're talking about jobs at a rate of about 9 out of 10 uh, who will make more than $15 an hour with those jobs. And so bringing those quality jobs back to our rural communities, urban communities as well. And just to lay out the percentage for you all, rural communities will have about 60% of those jobs, while urban cores will have about 40% of those jobs. So again, making sure that we can have a viable workforce. We don't have to have our tax dollars leave the state. And that really gets me to our next point. We're already paying for this. As of last Monday, there were 36 states who had expanded Medicaid who were benefiting from Missouri state taxes. And that money goes to Washington, D.C., and we don't see it back. And that puts a strain on us and our state budget. We've already seen cuts to education that has implications on cuts to infrastructure projects, that has implications on cuts to public safety. All these things that we know we need to address key issues in our state, ranging from infant mortality rates, ranging from gun violence to access to care. And it's all intersected, and we want to make sure that we highlight that, bring those tax dollars back. And by 2026, it's projected about $1.6 million. And that's where it's cost neutral. And when you think about cost savings, that's when you think about those jobs that are coming back, about 16,000 annually coming back at a rate that is a really high, but also representative in other states like Arkansas, Michigan, and really, again, showing evidence of how valuable this is, where it's been implemented, where it has been successful. Those two states in particular over the last 3 years have been able to demonstrate over $500 million in cost savings for their Medicaid program. So again, access to care saves lives. Extending Medicaid brings quality jobs back to our rural communities who have been so afflicted by the 10 plus hospital closures since 2010. But then lastly, bringing those tax dollars back home that we're already paying so that it can impact the change we need to see, drive the equity that we need to see right here in Missouri. And so what are some of those resources? As I mentioned, your organization is already receiving a lot of these resources. The toolkits that are available for your organization are for internal use. You will receive an email with links to our TV ad. The radio ads are running right now. And all the communications and the strategies that we're implementing in real time is available to you for your organization to share across your various platforms. And then each individual member can reshare that with their families, friends, loved ones, and their networks of people. And same with the organizational toolkits. That's the social media messaging. That's the disparities that exist within a particular population. Some of our coalition partners have been fantastic with creating infographics around the impact on women's health, the impact on communities affected by cancer, the impact on children and families. And so we can get all that information because we have such a diverse coalition group who has been so fantastic in this journey as we move towards Medicaid expansion in the state. But then lastly, how do you get involved? How do you volunteer? We have phone bank trainings, text banks, where your organization can host a virtual phone bank where you can reach out to voters, make sure that they hear these key messages. But not only that, text banking where you can text a friend to text 10 friends as well, making sure that we can do everything within our power to spread the word in a safe manner during this pandemic. In addition to that, we have Marv, our Medicaid ambulatory vehicle that we use that's touring the state, that's dropping off campaign swag. So the bumper stickers, the pins, the shirts, the yard signs are available. So we want to make sure that our coalition members have access to that. Marv is on the west side of the state right now, but you'll receive a link where yard signs are currently in St. Louis. And we want to make sure you can have access to that. They're going fast, so we'll be sure to replenish them. But we also want to extend the invite that Marv is available to come to particular events with advance notice. So we want to be able to get you all Marv so he can show up if you have any events in the near future or any upcoming community events with other organizations. Just shoot me an email and I'll be sure to get you connected with our field director, KJ McDonald, who is fantastic with ensuring our coalition organizations have all the resources that we have, that we're wearing. I know I wear my Yes on 2 shirt for about 4 days straight, going from event to event. And I promise you I'm washing it, but we want to make sure that we can get those resources to all our coalition partners as well. And so what are some of those key dates? And so as I mentioned, the last day to register to vote was yesterday. However, that next key date is July 22nd to request absentee ballots. Absentees ballots do not require a notary. To qualify for an absentee ballot, you have to be able to demonstrate you're a high-risk population or you're a caregiver for someone who's at high risk. But even if you request an absentee ballot but don't get around to mailing it, you can actually bring it to your polling site and actually vote in person still. So we want to make sure that you're aware of that. In contradiction or conversely to the mail-in process. So there's 2 key distinctions. There's 2 totally different processes. You can learn more at the Secretary of State's website on those 2 different processes. But absentee ballots are a more efficient way for voters to not only protect themselves, but also ensure their vote is heard and doesn't get complicated or convoluted with some of the other processes out there. Next, we have the Get Out to Vote strategy. We are already in full swing, but starting July 25th, you're going to see that ramp up to full throttle, where we're going to have multiple radio ads going. We're going to have multiple TV ads going, a lot of digital content, marketing content, mail content going out. We want to be sure to leverage our coalition organizations to share that information with your constituency groups and stakeholders. And then lastly, August 4th, Yes on 2, Yes on 2, Yes on 2. We want to make sure that all this momentum is going into August 4th so that we can see Medicaid finally expanded in the state of Missouri. After so many Missourians have spoken, we want to be sure to take the next step to ensure we can get not only access to care for so many, but bring those billions of dollars back to our state so that it can be reinvested in our communities throughout the state, whether rural, urban, no matter where people are. We want to ensure those jobs are reestablished there. We want to make sure we can redevelop rural hospitals after 10 closures We want to make sure that we can extend access for those populations working so hard for us during this crisis and beyond. And so with that being said, thank you again for your support. Thank you again for your leadership. Again, it's been an honor and a privilege to be with you tonight. I will put my email and phone number in the chat if you don't have a pen and paper by you, so that you can just copy and paste that and put it into a note on your computer, or you can shoot me an email tonight. I'll try to get around to it, make sure I get to you and get your questions answered, but the remaining of the time is for you, so I can take questions and answer them the best I can.
All right, Mike, we do have some questions backed up in the chat box. The first one is, who is organizing opposition to this, and what are their talking points that we should be aware of?
So there's multiple opposition folks organizing, but it is our responsibility to just focus on our message. And the opposition message really is, it raised taxes. That's false. It actually brings our tax dollars back. In addition to that, we, based on what we see in Oklahoma, there may be some partisan efforts to make this a partisan issue. However, what we do know is, no matter your party affiliation, no matter your beliefs, this extends access to care for so many. This brings our dollars back, and this establishes jobs, but also it helps us address the problem that exists in our rural communities with those 10 hospitals being closed. And so that's our key messaging. Those are the facts. Washington University has done research there. The reports are there. Others have done research. The evidence and reports that have come out of other states around cost savings, around the other implications that access to coverage has, is all there. And we want to make sure that we're highlighting that and not necessarily trying to fight this counter back and forth with an opposition message.
In sort of the opposite vein, someone also asked, who are the funders behind the Yes on 2 effort, and what's their motivating factor? Not what are the reasons it's the right choice, but what's bringing the commitment of your funding supporters to the play.
So you see all of our coalition organizations have participated in funding in some capacity. They're all public on our website. And again, we want to be completely transparent with that. In addition to that, this has been a journey. We know that Medicaid expansion didn't start in 2012. There were states that expanded Medicaid or tried to expand Medicaid as early as 2000. And so what has been the motivating factor is the evidence. What we have seen, and how that evidence has grown in the healthcare space, but also the impact that it has economically. And so you have seen more and more organizations come on to endorse. And so I would just say, just go ahead and take a look at that list on our website. And I think that endorsement list, that coalition list, the 300 plus organizations there, really speaks for itself, where they're very accredited, reputable organizations that has said, okay, we see the evidence, we see the information, and we want to make a pragmatic decision. And that pragmatic decision has been Yes on 2. And even the Missouri Chamber of Commerce really making a tough decision, and what some people see as a liberal agenda, which it's not. Again, we want to highlight the nonpartisan, bipartisanship in this effort, and it's all based in evidence and facts, and that's what I wanted to share with you all today.
Great. Another issue that several people have raised in the chat box is to wonder what assurances we have or how we can increase the likelihood that our legislature won't just turn right around and override the vote of the people on this issue as they have in the past. Is there a strategy around holding the legislature accountable?
Unfortunately, that's not up to the campaign. That's actually up to Missourians. And so we want to, as a fellow Missourian, we want to make sure that whatever happens, that the voice of the people is what sticks. And our governor has said that he will side with what Missourians side with, and that's what you can hold our state accountable to. And unfortunately, we can't do more. But again, the evidence is there. Share that evidence. And I think that this fantastic organization has been doing a fantastic job of that.
Interestingly, without naming any names, someone asked in the chat box if possibly the outcome of the gubernatorial election a little later in the year might play into the likelihood that a positive vote on Medicaid expansion would stick despite the legislature. Would you care to comment on that?
Yeah, politics is an interesting space. And so however Missouri votes, I feel like this is going to be a hot issue. And so there's going to be a lot to come of this, regardless of how the vote will be. And so we just have to stay glued, and we have to ensure that when Missourians speak up, that we hold our legislators accountable to that voice. And I know that's something that Missourians care passionately about. And so speaking as a Missourian citizen myself, that's something that we each individually have the power to do. And so that's where you call your reps, your state senators that represent you in your district, and exercise that practice. That's something that we must not get away from, because there's a lot of value in that. And that, I know it's concerning, and I wish there was more I could share on it, but the reality is, outside of the campaign, I have an opinion on it, but the campaign stance is this is our focus, and that's something that we want to respect and maintain the integrity of, because this has been such a beautiful, diverse coalition of organizations really wanting to do what the evidence shows us is right.
I believe someone said in the chat that they understood that the statewide Better Business Bureau had come out and endorsed this initiative. Is that accurate?
Yeah, the Missouri State Chambers of Commerce
Oh,
did.
I'm sorry.
Yeah,
I said that wrong.
Oh, no, you're fine. You're fine. They did come out and endorse publicly, which was a huge endorsement for the campaign.
Congratulations, that's great. And someone was asking if you could say a little bit more about the impact on rural hospitals. What is it that specifically that not having Medicaid expanded has damaged rural hospitals, and what sort of specific turnaround would be caused by passing this measure?
Certainly. So I don't want to get into the hospital financing, but just at a high level, what you see is patients who don't have coverage are going to hospitals, and those hospital dollars are stretched. And so when you have a large uninsured population, that means a lot of charity care dollars and community benefit dollars are going to cover them. And that stretches the health systems, the hospitals. Excuse me. In addition to that, Medicaid reimbursement from interventions in the workforce is not there. And so it's a two-way street where you don't have people covered, but then you also don't have that workforce that is providing Medicaid eligible interventions. But then also those individuals who live in those communities who are working at those locations, those tax dollars leave. And so once all of that economic downfall kinds of trickle into this big problem, that's when hospitals are forced to close. And we have seen it throughout the entire country over the last decade. And so just again, at a high level, those two factors in particular, which drives a lot of that.
Great, thanks, Mike. We have another question in the chat box that I'm not sure I can effectively translate for you. So I'm going to ask Laura if she could unmute. I believe it's Karen Francis.
Okay, I see it, the question from Karen.
Okay. And I will let you read that and respond.
Okay.
Nancy, that one was not for me. There might be another Karen out there, maybe Karen Hatchett. I'm not positive.
Yeah, I see it, and I can answer it. Thank you so much. And so this is where my expertise as a health administrator in practice comes in. I serve as a strategist of justice or health equity at St. Louis Integrated Health Network in my day-to-day. And what we do is really focus on access to care for the St. Louis metropolitan region with a focus on the medically underserved. And we have a principle where we strongly, truly believe, based on evidence and data, that we cannot achieve health equity without racial equity. So I just wanted to presence that first. And what we do know is healthcare is influenced by a myriad of factors, and those are called social determinants of health. And two things that we see that really influence health, the overall well-being of the quality of life and length of life, are policies and programs. And this is a policy in which lays the foundation for us to address socioeconomic issues in our community. So again, jobs and tax dollars coming back. It allows us to extend access to care to community members. And so between the two of those, that's 60% of the entire spectrum of social determinants of health. But then the last 30% is behavioral health factors. And we know that the opioid epidemic is really plaguing our communities throughout the state. And I know for a fact and a certain the best practice for addictive medicine is to couple preventative care with treatment, and making sure that chronic disease can be managed and primary care is available helps with that. And so that is not the answer, but it's a step in the right direction for our systems to be able to coordinate and address the disparities that exist.
So I'm trusting that that answered Karen's question, and that if she has any follow up on that, that she's going to type it in, because I can't see her.
I'm sorry. Yes, I was pretty much trying to type so I wouldn't be overloading or over talking anyone. My apologies. But yes, I did want some clarity on the St. Louis Equity Report. I am a NLF cohort member with UMSO, and we are a team that tackled the equity report and the disparities over several things. And one of the things that we are concerned about is mental health with our children before they become adult age. So I wanted to see if you can kind of refresh me again on the qualifications with children when it comes to coverage with this amendment.
Certainly, and I can also get you an impact report on children and families in particular. So, Kara, just please feel free to shoot me an email, and I can get that to you. But what we do know is this extends the eligibility criteria. So, a family of three now can make $30,000 annually and qualify for Medicaid. And before that, you had to make less than $301 annually. And so this allows access for children who do struggle with trauma that we know exists in communities, especially those of violence ridden. We do know that it extends the access to the level of care that many can receive. Mental health has been an issue. Not only in the state of Missouri, but in many states where we've seen providers really stretch their capacity. We've seen mental health providers really have to close up shop. And that really affects not only the children, but the family as well. And so speaking to the equity report specifically, I can't necessarily do, and not because I don't want to, but the specifics in there are just not on top of mind at the moment, so I do apologize for that. But the inequities as I know them, we know that it addresses all of those. And some of the action items for reports that preceded the equity report, like the Ferguson Commission report, the Forsake of All report, those have similar calls to action around inequities that exist. And I'm honored because I have the opportunity to work under the leadership of Bethany Johnson Javois, who was the managing director appointed by then Governor Jay Nixon of the Ferguson Commission. And so a lot of that is integrated into our work. You see a lot of that integrated into the reasons why organizations have endorsed Yes on 2. And so again, Karen, it's not the end all be all, it's just a step in the right direction so we can address those issues.
Thank you.
Thanks, Mike, and thanks, Karen, for raising that question as well. We're getting toward the end of our time together, but one critical question that, again, a couple of people have asked, and I want to be sure that we cover, is can you be a little more specific with us about get out the vote opportunities and ways that we can help, especially about the text banking, because I think that one is a little bit new to some of us.
Yeah, so text banking, as you all, excuse me, for anyone who's ever received a chain letter via email or Facebook or through a text thread, it's essentially that principle where you text 10 friends, they text 10 friends, and so that's just a campaign strategy, again, to raise awareness, but not only raise awareness, that information is coming from someone who they feel is someone who is knowledgeable, who understands the key facts associated with an issue and won't steer them wrong. And so I know for my family, my family just says, hey, Mike, just tell me who to vote for. And it's like, oh, I want to take a step back. I want to tell you why you're voting for particular issues, and let's talk through those instead of just saying, hey, yes, check this box. And so that's the value of text banking to friends. In addition to that, phone banking can be done organizationally, where KJ McDonald organizes a training for our organizations within the coalition and our volunteers, and then you have a script. And so it's not guided, it's not like you're just being thrown out there. We actually give you a physical script where you can reach out to voters throughout the state. In addition to that, it's just raising awareness right from where you are. And I think your organization is the epitome of that. You've done a fantastic job of that. And so just continuing to do that, leveraging your platform, doing things like this where we can raise awareness publicly weekly via social media, via our friends and families again. And I'm seeing the questions about training and yard signs. You will get an email immediately after this or at some point in the very near future. I don't want to put too much pressure on Laura, but I shared that email with her already. The two locations right now, one is the Jennings location for the Urban League, and the other is escaping me at the moment. Please forgive me. But if you go to our website, the Get Involved link, you can go to obtain a yard sign. In addition to that, Marv will be making its way back to St. Louis with yard signs, etc. And so we're going to make sure you have everything: pins, t-shirts, the bumper stickers, and all. So we want to make sure anything that we have that's been printed from the donations of the campaign that we get back out to our supporters. And I can't thank you enough for that.
Well, Mike, we definitely appreciate your spending part of your evening with us. I can only imagine that you have been booked back to back to back with the deadline moving forward. So our sympathies for how thin you are being spread. On the other hand, I'm sure there are many of us who are quite envious of the fact that you are allowed to tell your family how to vote, as opposed to having to duke it out with crazy Uncle Harry over the kitchen table. So it sort of cuts both ways. I'll just call to everyone's attention that Mike's contact information on both email and telephone are on that final slide. So if you want to capture that real quickly as an extra security blanket of being able to get additional information, it's right there. And I also want to point out to you that across the bottom of your computer screen, or it might be at the top if you're on a tablet, there's a button called Reaction. And if you click on that button, then you can click on a little symbol that applauds Mike for being with us. So since we can't applaud him out loud in real life, we can at least say a virtual thank you. And thank you to all of you for joining us for our very first virtual Women's Voices Raised for Social Justice. Yay, us.
Thank you again. As I mentioned, it's been a privilege, Laura. Thank you for the invite. Everyone, thank you for having me. There are people asking for more information. If you could just do me a favor and email me, because I won't be able to take down all your emails. And so if you could just email me, I will be sure to include you on an email with more information. As I mentioned, Laura will be providing an email that I've sent to her following this with all the links that you can go to get involved. In addition to that, we want to make sure you get your yard signs. So if those locations are out, we can be sure to get you your yard signs. Everything will be available. And if for some reason you can't get something, I'm promising my own personal time, I will deliver it to you. That's how certain I am that you'll get it. And so please, please, please just shoot me an email if you have any additional questions, you want more information. Do not hesitate, because that's what our coalition is for. That's what organizations like yourself is for, so we can raise awareness, show the impact on different demographics throughout the state that are affected by Medicaid access. Thank you all.